Hi, my name is Courtney, and for this debate, I will be taking on the role of moderator. We will be discussing the pros and cons of punishment.
Hi, my name is Emma, and I am going to be siding with punishment for this debate.
Hi, my name is Stephanie, and I will be taking the side against the use of punishment.
Hi, my name is Lauren, and I will be doing the conclusion.
All right. Whether or not the use of punishment is ethical has been debated for years. Along with other researchers, Muhlenberg, 1997, called for behavior analysts to first try antecedent interventions and other less intrusive interventions, such as extinction or differential reinforcement methods before using punishment. Functional analysis methods have advanced, allowing analysts to better determine the function of a behavior. In fact, according to a literature review conducted by Palios, Morin, Tesh, and Axelrod, 1999, researchers who conducted a functional analysis to identify the function of a behavior typically chose reinforcement-based methods over punishment-based interventions. Those who are in favor of the use of punishment often agree that punishment should be used only after all methods of reinforcement have been explored. However, those in favor of punishment argue that severe behaviors such as self-injurious behaviors, or SIB, it is necessary to combine reinforcement with punishment in order to see substantial changes in the behavior. Our debaters will cover many of the points used for both for and against punishment, and they will situate those within the ethics guidelines set forth by the VACB. Some of the codes include Code 1.01, Reliance on Scientific Knowledge, 2.0, Behavior Analyst Responsibility to Clients, 2.09, Treatment and Intervention Efficacy, 3.01, Behavior Analytic Assessment, 4.03a, Individualized Behavior Change Program, 4.08, Considerations regarding punishment procedures, 4.09, Least restrictive procedures, and 7.02, Ethical violations by others and risk of harm. We will begin by hearing from Emma first.
Substantial immediate suppression of problem behaviors such as self-injurious behavior is very important due to the harm that can be caused by these behaviors. Since punishment has proven to be effective in reducing serious problem behaviors in clinical settings, punishment may be essential for some cases.
Stephanie, how would you respond to claim that punishment may be essential in some cases to reduce serious problem behaviors?
Punishment tends to be cited as the most effective procedure for reducing behaviors, but research does not focus on the effectiveness of alternative procedures. More incomplete research studies on punishment are available than studies on alternative procedures. For this reason, many see punishment as one of the only effective procedures to decrease behaviors rapidly. This may not always be the case. Behavior analysts should focus on finding non-aversive procedures that can be as effective as punishment procedures. According to Cooper, Heron, and Hayward, the research studies used to prove the effectiveness of punishment are from 40 years ago. More research on punishment may yield results that show that, although punishment suppresses behavior rapidly, it is not necessary and other procedures can be as effective. Another issue with using punishment because of its rapid suppression is that there should be a bigger focus on increasing the client's skills instead of just focusing on suppressing behavior rapidly. According to Lavigna and colleague, there are moments when the speed of reducing a behavior should have less emphasis. On the other hand, building upon the client's skills should be emphasized. When taking into consideration intrusiveness, restrictiveness, and social acceptability, punishment may not be the best option. Considering these issues would increase the use of non-aversive procedures.
Thank you both for your thoughts on that. Stephanie, what are some limitations you see with the use of punishment?
Punishment may eliminate a target behavior, but it may result in other worse behaviors. Studies usually focus on the speed of behavior reduction, but do not focus on generalization and side effects of punishment. Behavior analysts should consider an intervention ineffective if side effects such as an increase in other maladaptive behaviors occur. Cooper, Heron, and Hayward name various negative side effects from using punishment. For example, punishment may increase emotional and aggressive reactions. A client may begin to engage in more aggressive behaviors toward the individual implementing the intervention or others that are nearby. Punishment may also increase escape and avoidance behaviors. In an attempt to escape the punishment, the client may engage in more severe behaviors. Modeling the punishment procedures and is another potential side effect of punishment. For example, the client may imitate the punishment procedures on others. The last negative side effect cited is that the implementer's actions are negatively reinforced. For example, the behavior is quickly suppressed when using punishment procedures, so the teacher is able to quickly remove the problem behaviors occurring in her classroom. According to Cooper, Heron, and Hayward, this may be the reason many behavior analysts use punishment procedures even when they are not necessary. Something that all behavior analysts should keep in mind when considering punishment procedures is that punishment is only used as a very last resort, as there are many side effects. Punishment should also only be used for a specified short amount of time, as the ethical code states a plan for eliminating the punishment procedure should be in place.
Emma, Stephanie claims that researchers focus too heavily on the speed in which punishment reduces particular behaviors and states that punishment fails to teach alternative appropriate behaviors. How do you defend the use of punishment when faced with these claims?
In cases of self-injurious behavior, when reinforcement measures have failed to teach the individual an alternative behavior, punishment is necessary in order to decrease the rate of behavior. When looking at the first figure, in a study conducted by Thomas and colleagues in 1999, the behaviors of 4 individuals who engaged in self-injurious behavior and who did not respond well to previous interventions were studied when reinforcement alone was provided, when punishment alone was provided, and when reinforcement was provided along with punishment. Researchers discovered that in the reinforcement condition, there was no significant decreases in the behavior. However, during the punishment condition, all of the participants showed a larger decrease in their behaviors when compared to the reinforcement condition. While this is promising, it is important for me to acknowledge that Ethical Code 4.08b states, if punishment procedures are necessary, behavior analysts always include reinforcement procedures for alternative behavior in the behavior change program. This leads nicely into the final part of Thomas's study, in which they found that the most significant decreases in behavior occurred when reinforcement and punishment were combined. In fact, not only did one of the participants decrease their SIB behavior by about half, it was noted that effort required by the staff implementing the procedures was decreased when reinforcement and punishment were provided. Further, when we're looking at the other figure, the frequency of punishment procedures decreased during the reinforcement with punishment condition. Additionally, to address Stephanie's point about punishment teaching other maladaptive behaviors, I offer a solution. It is true that punishment may have unwanted side effects. Take, for example, the rate of object manipulation for each of the 4 participants during punishment phases. This is significant because object manipulation is an incompatible behavior for these individuals, SIB. So reducing the frequency of this behavior is an unwanted side effect. However, while I agree that behaviors other than the ones being targeted for decrease may be unintentionally affected by punishment, Thompson and colleagues suggest that using reinforcement along with punishment makes it possible to shape appropriate behaviors. By combining the 2 methods, appropriate behaviors can be prompted and reinforced in order to build upon the individual's skill set.
Thank you, Emma. Next. Emma, tell me, what are some limitations of using reinforcement methods?
Using reinforcement in some settings, such as in a classroom, could be difficult if the reinforcement schedule required to create significant decreases in the behavior is too dense.
Based on the examples provided by Emma, what are your thoughts, Stephanie, on reinforcement schedules and how they might affect implementation of an intervention?
Functional analysis methods allow for the identification of the function of problem behavior, therefore opening the door to reinforcement-based treatments that address the maintaining function of the behavior. Although some reinforcement procedures may require dense schedules of reinforcement, there are still some options. For example, differential reinforcement of alternative behaviors, which is a procedure that reinforces a more appropriate behavior. According to Lavigna and colleague, DRA is the most used alternative to punishment. Fritz and colleagues conducted a study that found DRA with non-contingent reinforcement to be effective in reducing problem behaviors as well as an effective way to teach commands. And as you can see on the second graph, Fritz also found that non-contingent reinforcement alone reduced problem behaviors. Positive programming is also an alternative to punishment. Positive programming focuses on using functional analyses to identify the function of a behavior. Based on the identified function of the behavior, new appropriate behaviors can be taught. The functional skills taught will allow the client to interact with his environment. According to Lavigna and colleague, more time spent on using functional skills means less time spent on problem behaviors. They also mentioned that positive programming has high social validity and ensures the client's dignity. Although there are some limitations, for example, a few studies were conducted, the speed of effectiveness and longer process for implementation, Anderson and colleague mentioned the effectiveness of school-wide positive behavior support plan. One can argue that schools are a type of setting that make it difficult to implement reinforcement procedures, which is why punishment procedures are used, as they are faster in suppressing the problem behaviors. Teachers may have a difficult time attending to one student when there are many more students in the classroom. But Anderson and colleague found that school-wide positive behavior support is an effective way to decrease disruptive behaviors in students. This is a better alternative to punitive procedures used by schools. As for generality, school-wide positive behavior support plans have been implemented in a variety of different schools and have been shown to be effective. As long as every member that will be interacting with the client is on board with the intervention plan, non-aversive procedures can be implemented in any type of setting. It is important to always keep the client's best interests, even if it means taking the extra steps needed to use non-aversive procedures over aversive procedures.
The ease of implementation of an intervention is only one aspect of decreasing a problem behavior. Stephanie, why else might a behavior analyst choose reinforcement over punishment?
Although this point has already been made, I felt it important to include it as its own point. According to Carter and Wheeler and the Professional and Ethical Compliance Code for Behavior Analysts, the least intrusive treatments should always be used. Treatment should always be effective but should not produce unwanted side effects. As mentioned already, a functional behavior assessment will allow the behavior analyst to find a replacement behavior instead of just reducing a target behavior. Carter and Wheeler provide an example of one on procedures used by two different teachers for the same student. Logan, an 8-year-old boy with autism, engaged in SIB to escape assignments. So the teacher began reinforcing Logan for small amounts of work he completed. The amount of work increased until Logan was able to complete 3 assignments without engaging in SIB. When Logan switched schools, he began engaging in SIB to escape assignments again. The teacher used physical guidance to ensure he did not escape the assignments. Logan's aggressive behavior increased, but then decreased. One teacher used the least restrictive procedure, while the other teacher used the more intrusive procedure. But we were able to decrease the behavior, but the most intrusive procedure did increase aggressive behavior at first, which is a side effect. The point of this example is to show that least intrusive procedures may be more effective, making aversive procedures unnecessary. If there is a history of least intrusive procedures being ineffective, then more intrusive procedures may be introduced. But assessment should be conducted to ensure that the function was identified correctly, and the procedure should be reviewed by a committee. According to Lavigna and colleague, aversive procedures are not needed for undesirable behaviors. If non-aversives are effective for mild behaviors, then non-aversives should also be effective for more severe behaviors. The least restrictive and intrusive procedure should be used and proven to be ineffective before moving to more intrusive procedures. The problem with punishment is that many behavior analysts go straight for punishment as it suppresses the behavior faster. They may also not implement the punishment procedures as intended. This can be harmful to the client. It is very important to stress using least intrusive procedures first. The behavior analyst may find that a reinforcement procedure or even extinction procedure can be more effective than punishment.
Emma, Stephanie brings up the potential for punishment procedures to become harmful to the client. Keeping the ethical code in mind, how can analysts use punishment while still meeting ethical practices?
According to the Professional and Ethical Compliance Code for Behavioral Analysts, Code 2.09 states that clients have a right to effective treatment based on the research and literature adapted to the individual client. Punishment procedures, when executed in an ethical manner, may be the most effective and beneficial treatment for a client. Neglecting to provide a possibly effective treatment, such as punishment, is unethical regarding the client's rights and could possibly maintain dangerous behaviors depending on the client. Even though the use of punishment stirs up ethical issues, these procedures may be necessary if the reinforcer that is maintaining the behavior cannot be found or controlled, or if competing reinforcers cannot be identified. Punishment procedures are intended to decrease the likelihood of a target behavior occurring again in the future. This does not imply that all punishment procedures are intense or harmful to the individual receiving the treatment. A verbal reprimand is considered punishment and may be effective enough to reduce a challenging behavior.
Thank you. Now I'd like to ask you both some questions that have been provided by the audience. One second. Emma, keeping the core ethical principles in mind, how would you defend the use of punishment?
Punishment has the potential to do harm, but used in the right way and for right reasons, punishment can help to improve a person's life without causing harm. Behaviors such as SIB need to be addressed as it is a safety issue, and the client has the right to effective treatment. Once all reinforcement methods have been exhausted, punishment is an option that may be effective to reduce these maladaptive behaviors, and therefore allow for an improvement in his or her life. It is the duty of the behavioral analyst to ensure that when punishment procedures are used, they are used in a responsible way, and the avenues for reinforcement are available. In using punishment properly, a behavior analyst has the potential to benefit others without doing harm to others. Ethics Code 4.08 concedes that punishment procedure may be necessary and guides behavior analysts in implementing such procedures in a way that still respects the individual. Additionally, as long as behavioral analysts are implementing punishment within the boundaries of the ethics code, they should be following the core ethical principle of pursuit of excellence. Not only should the analysts be maintaining their knowledge of different interventions, they should also be ensuring that those who are involved in implementation are adequately trained and supervised.
Stephanie, how would you situate your side of the argument within the core ethical principles?
As for do no harm, punishment procedures can cause side effects such as an increase in aggressive behavior and escape behaviors. Rather than being effective, it can be harmful for the client, especially when using more restrictive procedures such as physical prompts. Punishment procedures should not be used, but if they are necessary, then they should be used with caution as to not harm the client. And for respect autonomy, when using restrictive procedures to decrease behavior such as blocking or physical restraints, the client's autonomy is in jeopardy as they no longer have control over their bodies or choices. Using less restrictive procedures such as DRA can teach them new skills that will allow them to be independent. For benefiting others, decreasing behaviors through punishment procedures will not benefit the client nor society since the client is not taught socially significant behaviors. But using reinforcement procedures to increase appropriate and functional skills will benefit the client and others long term. For being just, behavior analysts must also consider whether the treatments implemented would be acceptable if they were implemented on themselves. According to Bailey and Birch, being just means treating others how you want to be treated. When implementing punishment procedures, behavior analysts must be aware of the potential side effects and how this can be harmful to the client. They should ensure that if they are using punishment procedures, it is only because all of the procedures have been ineffective. As for according dignity, behavior analysts should respect their clients and work in the best interests of the client. Using aversive procedures can potentially violate the client's dignity. Clients have a right to effective but least restrictive procedures. Treatment should focus on teaching new skills that will help the client communicate what he needs or wants. Unfortunately, punishment procedures only focus on decreasing behaviors. All treatments implemented should focus on treating the client like a human being that understands what is being said and done to him or her. Lastly, pursuit of excellence. Behavior analysts should always be reading research to ensure the treatments being used are evidence-based and the most effective as well as up-to-date. Doing this may allow behavior analysts to find alternative procedures that are more effective than punishment. This could decrease the use of punishment as the most effective and rapid procedure to decrease behaviors.
Stephanie, why is this important to the field of ABA?
This topic is important to the field of ABA as it provides information on the pros and cons to punishment. Deciding on whether to use a punishment procedure can be a difficult decision, especially as the behavior analyst should consider the ethical issues with using punishment. Using punishment to reduce behaviors has been a controversial topic for some time now. Discussing the research can help behavior analysts decide on when it is appropriate to use punishment procedures. It also addresses the lack of research on alternative procedures, which make it seem like punishment procedures are the most effective for reducing behaviors.
Emma, how does consideration of this topic enhance practice and/or address current issues?
This topic is important to the field of ABA and the interventions implemented by analysts because it asks important questions. If we blindly move forward using punishment without considering the ethics and science behind it, has the potential to do harm to others increases greatly. By continually questioning and examining the effects of punishment, better decisions can be made regarding how and when, or even if, punishment is necessary or acceptable. Researchers such as Thomas and colleagues help to propel discussions surrounding punishment, while also helping to identify best practices and limitations of using punishment.
Stephanie, you're on the opposite side of this issue. How would you answer this question?
This topic raises awareness for the use of punishment procedures. As mentioned by Lavigna and colleague, there is less research on alternative procedures to punishment. There are many incomplete research studies on punishment. Punishment tends to be overused as the most effective treatment to quickly reduce behaviors, but this does not always have to be the case. Research on alternative procedures can also allow behavior analysts to be more aware of Ethical Code 4.08, which states other procedures should be attempted before using punishment procedures. This will decrease the use of punishment procedures when they are not necessary and can also decrease the inappropriate use of punishment procedures.
To conclude, as advancements in our ability to identify the function of a behavior are made, our ability to choose reinforcement methods will increase. It is clear that both sides agree that punishment should only be used after reinforcement has failed to change the targeted behavior. In order to remain in compliance with the ethical code, behavior analysis must use punishment only when necessary. Further, they must ensure that fading procedures are included in their plans and that only the least intrusive methods necessary are being utilized.